All right. Welcome to our studio today. We have Erwin and Mana Sweeney from Headlamp Health. How's life treating everybody at Headlamp Health these days?
Great. Thanks for having
Great.
us.
Great. So we're going to dive in and have some Q&A. And I'm joined by my colleague Ela as well. So we're looking forward to this chat. All things customer journey, and also we'll dive into some culture and values. So we're going to make it interesting for our listeners today. So let's start. I'll go with the first question. Headlamp was built around a deep technical problem. And what was the original spark in that moment when you both realized the pain was big enough to dive in, build a whole company to solve this?
I can take that. And, when Headlamp was first pitched to me, what resonated to me the most was the space itself, right? And the problem was real, the impact was real. And the very thought that if we got this right, even by a little bit, we could touch thousands of lives, that itself kind of got, goosebumps all over me. So that was a spark that kind of led me on to this journey. And I'm very glad I did it. From a technical point of view, if I have to talk, Headlamp is like mental health is a data story, right? I wouldn't say that mental health, lacks data. There is a lot of data, but it is fragmented and it lies in silos. We have behavior data, we have biology, they're noisy and messy HR data. And all of these are knowledge systems on their own. They have their own terminologies, ontologies, and it needs its own interpretation. And what we are trying to do is bring all of this together in a cohesive way for a patient at a place over time, right? And I feel that's very unique. And it's a very unique vehicle that we have built. And I come from a deeply a data background. I've built data intelligence systems in my past. And I really felt passionate about how I could put my experience into action and, really move the needle here in this space. As we speak at this point in time with the recent advancements in I only feel that the timing is so good. We have the right tools in place, and this is only accelerating our vision towards precision psychiatry. I'm really bullish about the agentic reasoning system that we are building on top of this unique data vehicle that we have, and really looking forward to it.
That's awesome. I think everybody who's listening to this today can resonate with that cause. So, all over the world, there's mental health issues that aren't being addressed. They're not being prioritized. So one little question, follow on the data part, Manaswini. So I'm assuming you need first party data, you need accurate data, you need lots of it. And apart from it being siloed across different systems, what is the other hardest part of getting the best data sets so clinicians can and practitioners can help people with issues? This can be either
Um,
for Owen or
yeah. I think it is about bringing all of this over time, like in a cohesive way, like bridging the gaps. They all exist in different systems, but maybe they don't belong to the same patient. You cannot really tie them to the same patient. But we are at the last mile. We are in touch with our users. We are the first point of contact for them. And we are bridging this gap between patients and clinicians. So what we have access to is we are able to bring all of this together in an accurate and right way and clear up the noise and mess. So Evan, you want to add anything to this?
Yeah, look, I think that the space we work in has some inherent challenges that Manaswini has already pointed out. But I think the real kind of high level challenge is how do you reason, even after you either generate or collect and clean up a lot of this data that's fragmented. Sometimes it's hiding in plain sight. Other times you simply just have to generate that data so that you know what ground truth is. And that's something we've done in spades at Headlamp from day one. But how do you reason? What can you query? What can you learn from that? And how does that impact how a clinician is practicing medicine, how a researcher is trying to develop a new drug, or how a patient is trying to have their immediate needs be met? And so what we've learned really by doing is that the ability to save years of frustration for patients, clinicians, researchers is not only impactful, but it's a spot that really hasn't been addressed. Hence the kind of accumulated layers of frustration by everybody involved in the space. And that's where really Headlamp pun intended, shines.
Yeah. I love the name, by the way. You're shedding light on all the areas that, people can get resolutions to their issues and in a faster fashion. And as you say, it's a perfect storm of AI having these capabilities alongside this problem that hasn't been addressed or prioritized. Cool. So over the last 2 years of company building, what would you say is the single biggest problem you've had to solve? And maybe you've already answered it. And how did you tackle it as a team? And what did it teach you about resilience and ownership?
I think the hardest problem for us, I'll talk from a tech perspective, but also from a team perspective. It was not about, KPIs or chasing metrics or running fast, right? It was more about in mental health, we are not measured by how many millions of downloads you had or installs you had or how many active sessions you have. It's more about, how many lives you touched, how many moments were made safe, how many people felt heard and seen. And building that, right, getting that right was more important than at what pace you're iterating. And that mindset and building that culture and getting the right people. We needed a deeply technical team to solve this problem who could work cross-functionally across life sciences, data, and design to build beautiful experiences. But at the same time, they need to be really have that empathy for the space and feel connected with the purpose. I think that was I really enjoyed solving this with everyone around and being surrounded by like-minded people who feel the same about it. That I would say was unique about this journey.
Yeah. And I would assume you're doing that in person as one team, but you're also doing it remotely. So you have to be a lot more sort of resilient and determined to make sure everyone's on the same page. Right?
I think everyone's from the team, echoes the same sentiment. So we've been
That's great.
very aligned that way.
Yeah. I would assume you'd have to be a little bit mission driven to be on the team. Right. Uh, okay.
Yeah, absolutely. I think, these scrappy, messy moments is what defines us. And Manaswini, I've seen you handle some of these things right out there in the field. It is actually the DNA of the company. So, Erwin, my question is to you about how, the team has been showing pure grit as part of the DNA of the team, which is maybe fast pivots or wrestling with ambiguity, driving it into some sort of clarity. How did you help your team build that kind of muscle when you came in?
Yeah, great question. So we do try and meet in person several times a year, and that is challenging because of distance and who flies where to meet at what time. But we do make a conscious effort to do that. And when we do that, we're able to do things physically. And so having built teams in through my career that are not only collaborative but come from very diverse backgrounds. So having a translational medicine scientist try and solve a problem with a software engineer or an ML or an AI engineer that just speaking the same language to define the problem is already a big hurdle to achieve. And so we spend a lot of time just trying to define problems, but building that muscle memory. I love physical activities and fun and team building with, and the team can attest to this. So we have several activities that we do that allow us to, in a physical way, be able to kind of demonstrate how to have your teammates back, how to communicate non-verbally when possible, how to measure cadence of a team and individuals. One person running at 1,000 miles an hour and everybody being left behind isn't a great solution. How do we manage that cadence so that we can all arrive at the finish line at the same time and feel good about it and have everybody's inputs voice, or flag the risks that we're willing to live with because we're a fast acting, fast moving startup. So there are several team exercises that we've done recently. We actually all took a half-day improv class at a theater, and just physical activities and completing other sentences. Those are theater games that might be silly and fun, but I immediately saw the results with the team in terms of how they interact, the level of trust, and just efficacy of communication.
Wow. Yeah, I love that, especially how you framed it. It comes to me like, grit is not just a personality trait, but it's something that we actually build as a muscle for the team. Very curious to create another segue into it. Like as a duo, how do you create a culture where engineers and operators keep learning, not just about the product or the market, but about themselves?
Yeah, so I don't like segregating the company into engineers and everybody else. I think that's a bit of a cop out. And my technical background is in engineering and chemical engineering, but I still don't speak the same language as a software engineer and vice versa. And so for us, as team members, title and background is fairly low on the list. And so what we do is we focus on this external third entity, which is the problem that we're trying to solve. And we really encourage everybody to bring their experiences, their educational background, orthogonal thinking and problem solving. But at the end of the day, it's the team that solves for best answer. That's another thing that we're really big on, is not what is the right answer. The right answer perhaps cannot be applicable just one day from today. And so instead of having folks kind of recreate a solution that is based on a discipline only, we tend to kind of round that out with individuals, their collective experience, and bring them together. So for us, that's our main goal. And that's really stems from our value and culture that we've built at the company.
That's a very interesting and thoughtful take. Thank you, Owen. Manaswini, the next one is for you. Like being a part of the Hive, it gives you a unique support system at Superset. How have shared learnings from within Superset's portfolio shaped your decisions or your leadership mindset?
Yeah, sure, right. Like, so I think from, from setting up India Entity in the beginning, I think with Superset, it was a lot more easier because you have these playbooks and rule books and a lot of resources and help to get started off with, right? I being a first time co-founder, that was really helpful for me because I came from a more larger company mindset and I had to do all those things from ground up. And I had other co-founders who had already done this couple of months before or 6 months before me, so they could help me out. So there was a lot of help and advice and of course, camaraderie there. And once you're set up, I feel the next journey is more about as you go through these ups and downs, it's a roller coaster ride, right? And Hive is full of energetic, entrepreneurial co-founders. You can always talk to them, and we're all solving problems in different spaces using the same technology. And it's always good to exchange ideas and collaborate to see how people are using things differently. Also, when things are going south, you could always talk to a colleague and see if they saw light at the end of the tunnel. That gives you a kind of support and say that, hey, hang on, you'll get there. So I think it's been great. And that way it always helps.
Yeah, absolutely. The term that comes to my mind is hope, as you were sharing towards the last part of the answer. I think this is the part that's very special about Hive. Like everyone is learning in real time, but the cross pollination of these lessons is what accelerates growth, develops that kind of muscle and trust that I've got this. So amazing. How would the two of you complement each other in practice, like especially in moments of tension or when we have to make trade offs? What have you learned about trust and communication, building side by side with each other?
Yeah, look, I think that takes time, but there's a huge level of respect that you have to have with the people that you work with. And again, I think the winning strategy for us is when you're able to externalize the problem that you're solving. It's not about Manaswini having the right answer or me coming up with a better answer, et cetera. It's both of us fostering and growing and solving something together and building on that. And if today I have more to contribute because the problem itself has some inherent features that I might be more accustomed to, or I've had a high level of experience and just background and context, then that's great. But we're always trading off. What I really appreciate about the team and Manaswini and some of the other senior folks at the company is that we're constantly asking each other, like, what do you think about this? And that, enables us to stay sane and not all kind of just shake our heads and say, yeah, that sounds good. We're able to challenge and push back on that. And even if it's something simple, it gives you the ability to step back and say, hang on, I've made this decision so many times the exact same way. Is there an opportunity to do something different, more creative here, as opposed to just, yes, I've seen this 7,000 times. This is the way it's done. Let's just move forward. Because we are, leaning towards speed of all things. But for us, we have to be mindful that there are real people on the other side. Um, somebody not using our service really has a huge impact to their loved ones, the overall community, health economics overall. And so we take that very seriously. And so it gives us the opportunity to step back and really quiz each other on how do we take this feedback that we've received or haven't received and really examine that for what's coming next for the company. And I think building on that has really been able to slingshot some of the achievements that we've made just in the last 12 months, actually.
Yeah, it's like co-anchoring a ship that's sort of in constant waves all the time. And that's exactly where the culture becomes even more important because we are moving fast. We are working with teams across time zones. We've just discussed this at the start of the conversation. I'm just very curious right now to know what are some of the tangible things that you do to reinforce those values in terms of, keeping patient first and owning it, being some of your words that are practiced and not just words on a wall.
Yeah, we integrate as much as we can our values into internal presentations. We haven't begun to do that externally because it confounds our messaging and we have multiple stakeholders. But I see a future where we're able to work with vendors and share some of those values so they understand what matters to us. So in our senior and all hands meetings, each meeting is themed after one of our values and we kind of highlight how that tracks back to it. And we constantly challenge that. So Manaswini spearheaded the initial set of values for the company, and we've evolved in the last 12 months as we think about scaling and as we think about new problems that we have to solve kind of beyond what's in front of the patient.
Great. I'm really enjoying this conversation. And I can tell from being in the room with both of you that you have a level of, finishing each other's sentences and a trust built up. So it's really nice to see. All right. So as you gear up for next year, 2026, what are you most proud of? This one's for Erwin. And what do you want to preserve as the company scales? And then what's one behavior or belief you never want to lose, no matter how big you get?
Yeah, it's a good question. I'm kind of giggling and laughing because it's not even the end of this year, and I'm doing a look back, and I think, wow, what a bunch of really significant achievements and just general transformation. So to provide some context, I didn't think that we would be in a position to really revert back AI-based answers to researchers and clinicians and to patients for probably another 18 months. And so we're here today. And so that's huge. That's a massive gift. Now, the gift didn't come on its own. A lot of hard work. Where most companies kind of slow down during the summer months, we actually sped up. And we sped up significantly. And so I'm super proud of the achievements that we've made to date. This is with a context and background of just a huge technological revolution that's happening in the background with AI. And that's really what we're exploiting and able to accelerate some of the stuff that we're working on. So that's this year. Next year, that's just going to continue, but it's going to continue in the hands of customers and very large, significant customers of names that you recognize, their logos, etc. And I think that is a significant tipping point for precision medicine in mental health, which is what's been really far behind other parts of medicine like oncology and cardiology by at least 2 decades. And so I'm very, very excited about that. I'm excited to see those results be reflected in the news and on headlines for next year. We have a lot of plans for the first half. And that's really going to set the mark for all of 26. But it's set to be a real banger of a year. And then the last, sorry, I neglected to answer one of your questions. So I'll jump on that. What is one thing that we shouldn't lose? I think creativity and problem solving. That's one of my main things. So I've scaled companies before, and some things you have to let go of because the scale just doesn't lend to it or starts being inhibiting. But the one thing that I think is one of our ethos advantages is to be able to solve problems very creatively. And so we're protecting those from an IP point of view, but I think that's very, very scalable. And I think others around the team see the value of that.
Yeah, that's awesome. I think the differentiation comes through when you do that, right? You stand out from the crowd. Congrats on all the successes so far and wish you nothing but the best for the coming year. We've just a couple of more questions to round us out. Manasini, the next one's for you. If you had to choose one value that feels essential to Headlamp right now, what would it be? And do you think everyone on the team would name the same one?
It would be act with purpose. And that's mostly because I think from early on as a company, we were very clear on what we are not, right? We were clear we are not any other data AI company that will just capture data or hungry for data. We knew that we are not just another chatbot company. So saying no to certain things has always worked out well to us, and we still continue doing that. And that's because our purpose is clear, our North Star is clear. Now we are at this crucial stage. I feel it's more important to focus with blinders on, to do more with less, and also not do things that are not important. And I think this value is going to help us make those decisions on a daily basis and stay grounded to where we started and why we started.
So that it sounds like the entire team really lives this value, and it's more like a shared language. Amazing.
Today's podcast, it's all going to be purpose from my end. I think.
If you were to finish this sentence, building Headlamp has taught me that, what would each of you say to it?
This is a really tough question because it's taught me so many things. But I think maybe the way I would answer it best is it's a recurring teaching, meaning that it's something I've learned before, but it's reinforcement learning. Let's use that phrase. That seems to be used a lot. And that is that people care. People care. And what I mean by that, it's not just the teammates. It's not just our supporters at Superset. It's the clinicians that we talk to. They care about their patients. They want to do better. The caregivers of these patients want to do better. Even patients want us to be better by providing feedback actively using, beta versions of different features, etc. And researchers want to do better. There's just such a gulf of frustration that is all uniquely aligned. We have a first mover advantage to be able to address that in a substantial way and really save lives. So without that, I think it would be very difficult. And in all honesty, I've been there before where there's misalignment between all of the stakeholders. And so the problem might be big, but there are varying levels of conviction and courage to solve those problems. Where at Headlamp, it's really reinforced to me that what we're working on is important, but it's because people care. And so that, when those cloudy days stick around for longer than you'd want them to, that's what helps us kind of think through. And at least for me, that if I speak to anybody at the company or any of our stakeholders, they would tell, this is important. You need to solve this. And I've heard this from people that have said that they don't want to be part of the company. I said, I can't commit to being part of the company right now, but you have to solve this. This is that important. And that doesn't happen very often.
I think for me, it's been that of resilience and conviction. I think adding up to what Arvind said, it's just too hard a problem to solve, a complex problem to solve. And we really need conviction and resilience. And that's what's taking us through.
All right. That concludes our Q&A. Thank you, Erwin and Manaswini, for all your time and sharing. It's been wonderful learning your journey and how you've stuck together with all the resilience and solving a really important problem. Thank you.
Thank you.
Thank
Thank
you.
you.